me to this session. I'm privileged to be here, and thank you, Reverend Shola, for the ministry. We're very grateful and thankful to God, and we pray that the ministry continues to grow from strength to strength in Jesus' name. So, as Reverend Shola has mentioned, I will be talking about one of the conditions, autism spectrum disorder. I've only got 30 minutes, so please bear with me. I'm going to try. This is a topic that can take over an hour to go through, but I just want to bring out some key things. One of the reasons why I decided to do this educational and intervention or information is because in my career, as a pediatrician, I have seen where families do not have the information. Sometimes in the clinic, it's very short time for us to explain things. Families don't have the right information, don't make the right judgment. And sometimes our perceptions from where we're coming from holds us back from actually um, acknowledging some of these conditions. So, so autism spectrum disorder is a neurodevelopmental disorder, and I'll explain what neurodevelopmental means because there are a wide range of things that we call neurodevelopmental disorders. These are conditions that have occurred from when the child is born. So it is not something that the child just gets, or it's not like an infection. It's something that has happened from the time the child the brain setting for the brain development starts when the mother is pregnant. The development is going on there, from fertilization, conception, the things are going on, the brain is forming. Sometimes in that process, the normal development or the way things are supposed to connect doesn't happen, and so you can get the results of that improper development or wiring of the brain affecting the way the brain grows and functions. And those functions can then be seen in the way the child learns, behaves, connects with others. And things that affect development affects the way the person is able to do things. It might not be able to do things as well as other people can do. So these are, when we talk about neurodiversity, the way the brain is affected can be in different way in forms and offer different presentation. So if you just look at this picture, all these conditions are under neurodiversity. So some people, it might affect their attention. Some people, it might affect the way they read words and process words, and you can get things like dyslexia. For some people, things like dyscalculia. So, but all these are part of neurodevelopmental disorders, and we're only talking about one today, which is autism. So we've talked about the fact that when neurodevelopmental disorders happen, it starts from birth, and the children that have these neurodevelopmental conditions, they do have their own strengths, but it's just that they're not doing things in the usual way that we expect children to do or people to do. So they require modifications, they require some adaptations, they require support. Some of them may need, uh, depending on the extent of the involvement, some of them may need lifelong care, but there are many of them that have fantastic strengths that if we don't know how to support them, we don't discover those strengths. So I have lots. The reason why I love the work I do is because I've seen children with lots and lots of different skills and strengths that if they hadn't received the support that they had early on, they would not have been able to get those strengths and develop those skills. There are many of them doing fantastic things, and this is where we need to be able to identify and support them. So coming to autism spectrum disorder is one of the neurodevelopmental conditions. And what autism means is that the way the brain functions because of the neurodevelopmental concern we've talked about, it affects the way that person communicates. It affects the way they interact socially with others. It affects the way they think and behave. So people with autism find social situations difficult. They find communicating with people difficult. They struggle with things that are not the way they expect it to be. So when they are expecting certain things to be in a particular way and it doesn't happen, they get very distressed. And they may also become very sensitive to things. So you and I can go into a busy train station, a busy bus stop, and we are fine, we are walking through it, but we have to remember that people with autism can get very overwhelmed with this, so that when you get into a busy market, a busy shop, a busy place, the reaction of the child can be very different, and the child may be very distressed. People may not understand and be saying, why is this child being naughty? So the core features in autism is that there's communication and interaction difficulties, and they may just like doing some certain things which we call restricted behaviors. They might just like doing the same things over and over again or do it repeatedly. And in terms of the prevalence, it's quite high. We're seeing the reason why we cannot ignore autism now is that we're seeing it more and more. I trained in Nigeria for my medical degree. I did my postgraduate in Nigeria. I came to the UK in 1999. And when I was in Nigeria, I wasn't seeing lots of autism, very rare. We didn't even know what it was. But I can tell you now that in many African countries, in Nigeria, we are having so many. So the incidence has increased here and in Nigeria and in Africa, all over the world, there's an increase. So we cannot ignore the fact that, we're having more people being affected by it. It's affecting more boys than girls, but that doesn't mean girls don't get affected. It's just that girls present differently, and it's sometimes quite late to pick up the girls. So, how common is it? It's like I said, it's increased a lot. It's rising faster. We're getting many more people diagnosed with it. And part of the reason is that many people are becoming more aware of that behavior. So sometimes now, if we look back in our families, we may recognize somebody in the family that probably had those behaviors. But what we do know is that people in our minority groups sometimes are underdiagnosed, not because it's not there, but it's because people are not coming forward for the assessments. So just to show what happens with normal development, as many of us here are probably parents, we know what happens. So when a child is born, as the child is growing, the child is responsive, looking at the mother's face, smiling at people, enjoys being hugged. As they're growing older, they're becoming more excited, they respond to other people, they show happiness and pleasure, and they now begin to play with different toys. They begin at a particular age, between 6 to 12 months. We know that when they don't see their parents, they can become a bit anxious, but they know how to communicate. They will point at things, they will bring things to you. So you know what happens with the normal development. Between 12 to 18 months, the child becomes more interested in other children. They try playing with things, they try new things when other people are around. They show feelings, like if they're upset, they will cry. They point to show things to others. So we know what happens with normal development. And this, what we mean by joint attention is that this is very important for mothers who are nursing young children, that this is what you expect as children are growing up, that when you're looking at a child, you expect the child to look at you in the face. Sometimes they make good eye contact with you. If you move your face, they're moving. If they want something, they're looking at you to make sure that you know what they're looking for, and they point so they can look at you and point to make sure that they know what you are looking for. That's what we call joint attention. Now, we this is important because this is one of the early things that people pick up when a child is growing up and suspected to have autism. They see that that child is not really looking at them. The child just goes to get what they want. They don't reach out for the parents. They don't point to things. They don't try to get your attention. So if you are picking up that in a child, then you should start suspecting that something might be wrong. And what are the causes of autism? Well, a large part of it has been felt to be genetic, and it felt to be that sometimes the alteration in the genes can alter the way the brain develops. So part of that problem with the brain not developing well is sometimes genetically driven. So the gene modification prevents the brain from fully developing into the way it should have developed and modifies some of these things. There are also things being looked at about environmental. Is it some exposure to toxins? Sometimes we do find sometimes children born from assisted reproduction have a high risk of developing autism. It's been picked up more with them. If the mother has been exposed to some medications during pregnancy or harmful toxins, it could affect brain development. If there have been complications from pregnancy or mothers had some infections, all these things will disrupt the way the brain is developing and can then impact several of the brain functions. So we've talked about what normal development is. So we need to look at what is abnormal development. So those things, if all those things that I listed, the baby is not doing them, then you begin to suspect, is there something going on with the way this baby is communicating? Because you expect your baby to smile at you, to show interest in you, to look at your face. When you're carrying them, you expect them to get some reaction. If you're not getting those kind of reactions from the child, then you should begin to suspect that is something happening. If you have a child that is having difficulty settling, they're crying all the time, sometimes they're not even settling when you carry them, or maybe they're attached to a particular object, and if you take that object away from them, they scream and scream until they get that object back, then just keep watching. It's a collection of things that, is this baby developing the way they should be developing? And then when it comes to social interaction, the child struggles to be with other children. They're not interested. They don't even, some of them don't even like being near other children. They don't smile. They have poor eye contact. And sometimes they don't respond to their names. Sometimes you might call and call them and they don't respond. They don't do things like nodding, shaking their head. They don't wave at people as they're growing up. They are like in a world of their own. They're completely locked in. So think about, if is there, as a parent, if you see any of these things, begin to suspect, is there any problem there? Is the child having unusual attachment? Sometimes what they do is line things up repeatedly. They might go around the house just lining things up, and that's all they're interested in. They're not really playing with it. They line it up, they start over again, they line it up. They want things in certain order, and if you move it, they go back and replace it. So if you're picking any of those things, do just try and seek help. Sometimes you find children who just repeat words, they're not really speaking. They just repeat words. Sorry, is that okay? I'm just hearing some. So they repeat words, they repeat things that other people are saying. They might do things like rocking continuously. One of the things I've said is, if you change what you usually do for them, if you change their routines, they get upset. If you don't, maybe sometimes you're dressing them up after and then feeding them. If you feed them before you dress them up, they can throw this massive tantrum, and you may not understand why the child is throwing that tantrum. It's because you've not done things in the order in which they like. So if they know that that's the route that they usually take out of the house to go somewhere, if you take another route, they can become distressed. So noticing things like that. Sometimes it might be sensory things, like they might not like a lot of light, a lot of noise, or they don't like people touching them. Some children don't like people hugging them. If you notice things like that, or the food. Food is something, they are very particular, very fussy. Uh, and in older children, it can be different. They find it difficult to make friends, and they don't understand when you say certain things. They don't take jokes. They are very sensitive as well to being outside. They struggle to make friends or understand other people's feelings. So sometimes you might be very distressed, and the child doesn't even notice that you are distressed. Girls are different because sometimes they might look fine, and that's why sometimes it's difficult to diagnose the girls or pick up the girls quite early, because they can look like they're very friendly, they copy other people's behaviors, they know how to behave, they can sometimes talk well, but people don't know that they are really struggling because they get very exhausted in those situations, and they get very anxious as well. So girls and women tend to internalize their feelings rather than put it out there. Like you might pick up with the boys. So you might not know that that girl is anxious or depressed. And again, you have to look at their language. Is that speech developing well? If the speech is not acquired before 3, some of them, their language can be disordered. So other things that can be affected, like we've talked about, their feeding, their sleep can be affected. Sometimes some of them just struggle to sleep, and this might be one of the big problems. So things like going to school can be a very big problem. Some parents might find it difficult getting the child to school in the morning, getting them dressed. They get very distressed, very worked up. They're very anxious in the school environment. And it's not surprising because the school environment is very busy. So the risk of having a child with autism used to be about 1 in 68, now is higher. And if you have a child, there's an increased chance of having another child with autism if one sibling has autism. And if you have 2 children with autism, there is an increased chance of them having it. So I do have families with 2, 3 children with autism spectrum disorder. And a family member with autism increases the risk of the person developing autism as well. So what do we do for assessment? If you're in the UK, if you suspect your the child is showing any of these behaviors, we usually say approach the GP. The GP will refer to the pediatrician, and the pediatrician will carry out the assessments. I'm not going into the assessment today, but we do the assessments, and it's a lot of information. Sometimes we need the speech and language therapist and psychologist with us doing that assessment. The outcome, when you pick up children early and you put it intervention early, the outcome is better. And that's one of the things about pushing that message of early intervention matters. The earlier you put in, you discover that, the earlier that people can work with the child, the better the outcome. And that's why we don't want people to delay, because when you delay getting them assessed, other problems come in. Delayed diagnosis can lead to mental health concerns, anxiety, depression, because the people affected get very frustrated with trying to deal with the world on a day-to-day basis. And so they then become anxious and depressed. And we've had a lot of problems when people are not diagnosed early. What are the barriers to seeking help? Sometimes parents might believe that autism is caused by other factors. And I see this a lot of times in our African population where people might think, no, it's not autism, it's being caused by this or that. The stigma, people might feel, how can I say, how can I say there's something wrong with my child? And just to let people know that autism cuts across all cadres. We have professionals with autism. We have doctors, lawyers, people of high levels with autism. It's about picking it up, knowing how to survive, knowing how to have adjustments, knowing how to make the workplace, the school help that child. Because when those things are in place, then things can get better. It's about picking it up and putting the interventions. Sometimes people think it's a spiritual attack. Sometimes people think it can be preyed off or parental disagreements. So where's the role of the church with ASD? Just quoting some scriptures, the 1 Corinthians 12:22 to 27 says, those parts of the body that seem to be weaker are indispensable. So no, you can't. You're at the body of Christ, and each of you is a part of it. Every person with any ability or difference is vital and welcome in the church community. We're all part of one body. Galatians 3:28 affirms equality and unity, regardless of background or difference. There is neither Jew nor Greek, slave nor free, male nor female, for you are all one in Christ Jesus. And Romans 12:45 says, just as each of us has one body with many members, so in Christ, who are many, form one body. Celebrates individual differences and interconnectedness as the foundation for inclusion. Just to remember those backgrounds. So how can the church support people with ASD? We need to raise awareness. We have many children with autism coming to our churches, coming to Sunday schools. Some parents have felt that people have not understood their children, and some children have had to stay back rather than be part of the church, because when they come in, they feel they're disruptive, they're screaming, and because people don't understand, they don't make allowance for them. Invite their families to share their experiences and provide some training. Those families with children with autism, they know a lot about how to support the child, and they can help to give information to the church about how to support them. Consider ASD as part of the church diversity and mission. Encourage the church can be sometimes the ones that pick up these things. I used to teach in children's church in my church, and I used to be part of the children's workers. And we, in that group, regularly we will have children coming in, including those that are autistic or those that are showing some signs. I have been involved in supporting those children. Sometimes when the parents don't understand the behavior, I've also given information there. So we can be part of that mission of helping, and now the church I attend is very neurodiversity friendly. There are rooms for the children to settle their toys, neurodiverse toys for them. So they're very much part of it, and many of them have done really well. Encourage parents to seek an assessment when it's needed. Offer schedules that are visual to make things quite visible for them, create sensory places, friendly worship places, provide quiet zones. Look at the lighting, because loud sounds or sudden noises can make them very distressed. And respect personal space. Some people, even the adults, may not like handshakes or hugs, so you need to adapt greetings. So instead of thinking the person is awkward, think about, is there a reason why they're sensitive and they don't like that being done? And then use simple, clear language. We have to remember that people with autism struggle with being given a lot of information. So think about how you're presenting information to them and involve them in planning any changes that is going to happen. Prioritize inclusion and adapt the environment. So I'm just going to stop here because, like I said, there is a lot, and I'm trying to pack in um, autism spectrum disorder within this short period. But like Reverend Shola has mentioned, I host Early Intervention Matters podcast. On that podcast series, there are stories of families. I've had guests of families who have gone through the journey of autism spectrum disorder themselves, with the children. I've got adults, young adults who have grown up in Africa who did not know what was going on with them, and they later got a diagnosis of autism. I've got stories about one of my young boys who I looked over for over 10 years or 11 years, who he has ADHD, but he struggled in school, but he's doing exceptionally well now. He's working in the city. Nobody ever expected that to happen. He's running his own business. So there are lots and lots of success stories. I'll encourage you to listen to the podcast there, because there will be a lot that you will gain from there. So thank you very much, Reverend Shola, for offering me this platform to share this, and I'm happy to take questions.
Thank you very, very much, Doctor. God bless you. This is very, very inspiring and also very insightful. And I believe that many people, have got something here, even if it's just one thing. They've got one thing to take back to their respective homes, whether they are teachers, whether they are social worker, and we have quite a few of them here. If anybody has question, we just take maybe another 5 minutes to take question from everyone. Doctor, do you want to maybe pull down your PowerPoint so that we can see questions, please?
The questions.
Hello. Good morning.
Good morning. Good morning.
I have a question.
Make it short and sharp, please, so that many people can also ask.
I have a question. I mean, I did a bit of neurodiversity at work, just little bits, and it just came to my mind that maybe members in my family might have it, but they're adults now. So I was wondering, Do they do assessments? I mean, you said you do assessments for adults. What is the likelihood of that it can be managed if that is the case?
Yes, so I'm a pediatrician, so I only do assessments for children. For adults, many adults are getting assessments. There are when it's very important for adults to get the assessment because many adults have had poor experience in the workplace, their colleagues not understanding them, conflicts, people thinking they're rude people, they can't cope, they can't work in a team, not understanding that that adult has difficulties. They may be very anxious with communicating with people. They may find it being very difficult being in a very busy office. It might be the noise in the office that irritates them. They can't voice it up because when there's a lot of noise, it can make them really upset and they can, sometimes just get frustrated and lose their temper. So when you put in the accommodations and you look at what helps that person, you can make things better. We have we actually now in the medical associations, we have departments looking after doctors with neurodiversity. Because it affects them even like when they're going for exams, going for different things. We have departments now looking after them. In many universities, it's so important. Universities have sections for neurodiversity because they recognize that there's a difference made for people to function better when they have their difficulties and differences looked at and the accommodation made. So please, it will be good for them to go for assessment.
Okay, thank you. One more quick thing. They have an online
Okay,
tool where you could use it. Is that accurate, or is it gives you a little bit of?
It's just a screen. Most of those online things are screening. You have to go through a thorough assessment. A thorough assessment is very comprehensive. It uses very standardized measures, and the process is quite robust. So it's not just the online tool that gives you a diagnosis. The online tool can say you have traits, but that means you need to go for an assessment.
Thank you so much.
Okay, thank you very much. Thank you. There are two hands. I'll take in order. I'll just take Adiola first and then Prince, and then I'll go to the chat.
All right. Good morning, everyone. Morning, Pastor B. Thank you, Doctor. Now, my question is this. I know an adult male who has stopped going to church. One of the reasons being that, in churches, they say, oh, maybe shake the person next to you, say good morning, and he found all that a bit overwhelming. So does it mean that he has ASD?
Well, I think it would be good to explore other things with that person because that person stopping to go to church might be part of the reason and maybe part of the church. When we are used to being in church with a lot of noise and drums and sounds, where we take it as being very normal. But for some people, they struggle and they might struggle with the church being very busy. They might just struggle with again, sensory issues. They might not like shaking hands because of sensory issues. That's probably one of the reasons. So I think it's good to communicate with them, with the person. And that's usually the problem, is that when we don't understand, we look at the person and say, what's even wrong with that person?
Yes.
Are they rude? Why are they behaving like that? They don't like talking to people. They don't smile. They don't greet people. The only way we can understand them is by exploring things further.
All right. Thank you.
Okay, thank you very much. Prince.
Okay. Thank you. I must appreciate the moderator and pastor, and also the pediatrician in our midst. I've gotten an insight about what ASD is. I never believed in this, but going through your presentation, I think I started kind of having a belief towards its attachment. Why I say so, I've got a kid who is 7 years old. I've choose not to believe he has this, even though they've picked it up and flagged it at the school. He has gone to see the GP and they kind of diagnosed him this, but they're yet to kind of conclude on the diagnostic kind of assessment on him. So, but I have a problem trying to manage him because I've been asking for this support to get to know him better. My question is it possible for a child with ASD to kind of make up things? Why I say so? Because currently there's something we're trying to deal with. A child will wake up and say, Daddy beats me, mommy beats me or mommy hates me. He gave an insight sometime about beating, whereas I wasn't even at home, and he was kind of citing it towards me that daddy beats me. And when I came back, it looks so weird to me, asking where this is coming from. Is it part of their behavior that they can imagine things or probably say things that doesn't happen or never occurred?
So thank you for bringing that
Okay,
up,
thank you
because I
very
think
much. Doctor will answer that. Thank you.
I think that that's so important, because children can say, they can repeat words, they can say words repeatedly, and that's why it's so important to understand the whole child. So sometimes they might hear words from somewhere and then begin to repeat it, and they might repeat it at another time. And it's happened many times where some parents have been, a child has repeated words at school, and then the social workers have been invited, and there have been safeguarding concerns. And like you said, I think you've given a classic scenario, because I've seen this happen a few times. And then when you then see the child and look at the child and understand that the child is autistic, and see that they have repetitive phrases which they might have heard. They have echolalia, they might have heard things from somewhere, they repeat it, and they'll just wake up and repeat the words might be stuck in their minds, they just repeat it. So if people don't understand the whole child, they might just think, oh, what he's saying is true, but not really understanding that that child is probably going to a repetitive, some words they might have heard somewhere. You probably will not know where they've heard it from, but it's so interesting. Sometimes things just stick to their mind and they keep repeating it. And that's why it's good for people to understand the child.
Thank you
So
very much. Okay, I'll
Okay,
take
thank you.
another.
Thanks.
I just want to Apostle Jackie. Okay, just and then I'll go to the chat now after Apostle Jackie. You are muted.
Yes, I'm sorry. Thank you so much, Dr. Takon. That is so helpful. I used to work in early intervention, and I actually missed autism in my child, because in time past, we didn't talk of these things. The word autism wasn't even mentioned when I worked in early intervention. So my children are 40 and 37. Can I just ask about one behaviour that I've noticed in my family? Basically, I can be talking to them. I don't think I come up as autistic, but I can be talking to my daughter especially. And what will happen is everything will be fine. We'll be getting along fine. And then suddenly I'll say something completely innocuously and it'll be, Mum, get out of my life forever. And she will literally block down, refuse access for a period of time. And then there will be a crisis where she needs her mum. Is that part of the disorder?
So has your daughter got autism?
I think she may have. My
Yeah.
grandson, definitely, his father has been recently diagnosed with autism, which does make sense from the way he is. And my daughter, when she was pregnant, she actually ended up in a mental hospital because she had thought she had made her baby autistic.
So
I
yeah, well,
don't.
Jackie, what I want to say is
I just
that
wondered about this blocking behaviour.
it does happen. What we call it is a shutdown. They're very sensitive. They take things quite literally. So a completely, you know, not no problem statement from you. You saying your normal conversation. You'll be shocked what they can pick up from that conversation that can just upset